5 years ago, I developed throat cancer. I was a smoker. I'd stopped 10 years before that. I was a bit of a drinker, but not to excess. But I developed a tickle in my throat, and I got throat cancer, whoopee-doo. Since then, of course, I've now been left with the fact that I've got no saliva because of the radio and chemotherapy that I had to have. And I came through that treatment, which is really good. I'm now at the 5-year point. And during that particular time of coming through the treatment and my recovery phases, I got involved in various sort of cancer charities. I got involved in various groups. And because I tend to talk for England, I was recruited onto various sort of committees, which I'm still on now. I started off by peer reviewing hospitals, as a lot of the guys do around here that you've already interviewed. And from that, I then came to this conference a year ago. And somebody tapped me on the shoulder and said, would I get involved in the CLG and then the Clinical Studies Group of Head and Neck Cancer. And I want people to have a little bit of a better treatment path than I had, although I will not complain at all about the treatment that I was given. But I want them to have a slightly better treatment path and a slightly better outcome. And that, if I can do that by going on a trial, which I did do, which took 6 months, and you are prodded and poked around a fair bit, and you accept that. And it was good fun, and you were treated very well. And you felt special. You felt as if you're actually contributing to something. And the bit that I feel, and I and my colleagues feel that are contributing, was the well-being of those people that have come behind us. Not in any sort of tear-jerking way, but the fact is, if you can give, and you can give a little bit, then this is one way to do it. And I found it extremely rewarding. Get involved and have a look at this trial and see if it's possible to do it. I sit on my local cancer network, RAT group, which is the Research and Trials team, and then we're finding ways of trying to actually encourage patients to come on board and do it. Some cancers, it's very, very difficult to know the stage that you're going to ask the person to come on the trial, because being told you've got cancer, or will you go on to this trial, which is considered an experiment by some people at that time, is quite difficult. So having a good team there to be able to say, this is what is happening, this is what it's all about, all based normally on the clinical nurse specialist who knows how to cuddle the people, knows how to cajole them, knows how to bring them on, and then perhaps can buddy them against somebody that's been on a trial to actually say, this is how it happened, this is what you did. You know, it's not a Frankenstein thing. It's actually taking people forward and doing it in a reasonable way, and that's what the majority of people do. There is a good team of people that are out there trying to make things a lot different.